All right. So you know where the bathrooms are. I don't have to do any of that housekeeping. Tea and coffee over here and water. This workshop is a collaboration of the Canadian Pharmacists Association, the Victoria Order of Nurses, or the VON, and the Canadian Association for Community Care and Caregivers Nova Scotia. I'd like to acknowledge the support of Health Canada in producing this workshop and the resources that we're sharing with you. This workshop was developed for seniors and their caregivers, but it is relevant information for everybody. We have updated the workshop to suit the unique needs of seniors and caregivers in Nova Scotia. And the purpose of this workshop is to help create awareness of practices that promote and support safe use of medications. And we all know the number of seniors and caregivers is growing rapidly, so it is very important that we understand about the safe use of proper medicine. I'm a senior now. I'm so excited. So, and I'm on medication, so I know we have to pay attention, and as we age, our bodies change, and so sometimes we metabolize medications differently. And so that's something to have conversations with your husband about, or with your pharmacist about. All right, we can go. We have our land acknowledgement. So we know that we are on Mi'kma'ki territory. It's unceded and unsettled territory for the Mi'kma'ki people. And we recognize that we are lucky enough to live and work on their territory and really appreciate that, and are committed to our education as well as promotion of safe and inclusive spaces for everybody. Thank you. Oopsie. Okay, we can go. You know me already. Okay. When I was here last time, I talked about our programs and services with Caregivers Nova Scotia. So we do information like this. We do one-on-one support by phone, support through support groups. We do educational pieces as well. So this would also be one of our education pieces that we do. We do understanding dementia behaviors, caregiver stress management, safe use of meds, and the importance of mouth care. And I think we're going to be doing that one in the winter. Okay, great. We talked about this. Yep. We talked about the tool guide. And Sorry.
Oh, one back?
No, it's just me trying to figure out what number I am. Can you see the number there?
Oh, that is... Oh, no, it does not say.
Okay.
So I think it's slide 6.
Okay, thank you. Okay, it's important to understand that people react differently to medications. Has anyone here ever experienced side effects? Okay, so you know. And we know that when we introduce new medications or vitamins or stuff from the natural food shop, you know, black cohosh or glucosamine and those things, those can all have interactions within our bodies. In Western medicine, we tend to focus on the brain as like the center of our body. In Chinese medicine, they talk about your stomach is the center of your body. So when I learned about that, I mean, it makes sense. My grandmother always used to say, you know, you are what you eat. And literally, you are what you eat. So everything you put into your body has an impact on your body, including medications. We know as we age, our bodies slow down, our metabolism slow down, so our ability to metabolize some medications can change over time. So asking your pharmacist for a medication review is important if you've had a health change. I know some folks do not have nurse practitioners or primary care physicians at this time. So we can end up going to a walk-in clinic and getting a prescription, or emergency and getting a prescription, or something like that. And we may not have a dedicated pharmacist that we go to help us sort out, is this going to have an interaction? And not all our medications are recorded. We haven't gone to a complete online system so that doctors in emergency or at a walk-in clinic can look and say, well, you have all these medications, and look for effects between them. We don't always have those eyes on the medications that we take. So before you get the medication prescription, talk to your pharmacist. They may have a cheaper medication. They have a medication that does the same thing that's under pharmacare. They're just a really good ally for you, and they're very knowledgeable. Okay. Very good. We can go past this. Okay. We know who caregivers are. There we go. So I changed this number yesterday. 22% of people in Nova Scotia are seniors. That's from census in 2022. So we always have known Nova Scotia has an aging population, the oldest population in Canada. We also know that we have the highest incidence of chronic long-term illness in Nova Scotia. Lots of diabetics, lots of MS, Parkinson's, Huntington's. So lots of these long-term kind of COPD. Lots of people in Cape Breton were coal miners. A lot of them are gone now, but we're hard workers in Nova Scotia. And so, it starts to catch up after a while. We know that almost half of all medications prescribed in Nova Scotia are for seniors. I know I'm diabetic, so metformin, a statin, I'm on a few different, the Father, Son, and Holy Ghost of diabetic medication, they call it. Average older adults take 5 prescriptions and 3 over-the-counter medications. So over-the-counters like our Tylenol or our cold medications, those sorts of things. And 30% of all ER visits are related to drug interactions, over taking it. We make mistakes. I know when I started taking meds, I couldn't get my schedule down. Like I'd put them in my pocket in the morning and say, when I get my Tim's coffee, I'll get them. And then at 5 o'clock when I get home from work, they're still in my pocket. So that's on me. I have to be better at taking. Is that right? So, we say all these things, but they are practices that we have to get used to. And when we're caring for somebody else, because a lot of us do support someone to make sure they're taking their medications on time and those sorts of things. We also know that cognitive decline is huge in Nova Scotia. So I think now they're calling mild cognitive decline as any of the dementias, traumatic brain injuries, stroke effects, Parkinson's, dementia, Down syndrome. We know as people with Down syndrome age, the chance of developing dementia is very high. So we know that those people can need support as well with taking their medications on time. And I know so many people where folks forget, did I take that or didn't I take that? And then over-medicate and then end up in the ER. So it's really important to develop practices around that. Thank you, Samantha. And sorry my back's to you, dear.
Oh, that's okay. Your back's to the camera right now.
How about I stand over here?
Anywhere around here is fine.
Okay,
Yeah.
Okay, thank you. So medicine is almost anything people take to feel better or to feel more themselves or to feel well. That's why we take medications. That's why we take our vitamins. We want to be healthy. We want to take care of ourselves. Prescription medications are the same thing. I don't know if you have people in your life that say, my husband had a bad snowmobiling accident. He was in the hospital and he was in traction and everything and in a lot of pain from the impact. And he would not take pain medication. He had in his head that I'm not going to take it. And I remember my friend was the nurse and just took him and said, if you don't take that, your children are not going to come to see you because you look scary, you can't move, and you just need to start taking this so you can get better. So, like if you're, lots of us are proud not to take medications, but medications are given to us to have a better quality of life, to be healthy into our old age longer, to be healthy in ourselves, healthy in our minds, healthy in our bodies. So, sometimes when a doctor prescribes something, we can also challenge them and ask them as well. We don't, doctors are not always the best. Doctors don't always know you the best, especially if you're going into a walk-in clinic or something like that. If you don't have a list of the medications that you take, it's very hard for them to be able to determine whether there would be a cross side effect or something like that with the medication. So the more information you have, the better. Let the doctors know if you're taking anything else. If you're taking, like ibuprofen every day for something. There's research around taking a really mild acetaminophen helps with, heart and stroke and stuff like that. Your physician, your pharmacist needs to know all these things. Even with natural medicines, with my sister-in-law keeps trying to get me to take this bone builder. Helps, as we age and we don't have as much estrogen in our bodies, our bones get weaker. We all know this. My mother had osteoarthritis, so I get it. But the doctor would tell her one of the things that she was taking was a I can't remember the term, but it acted with one of her diabetic medications. And so it really impacted the metformin on her body, and her sugars were going crazy and she couldn't figure out why. Well, that was why. So it's always important, anything that you're taking by mouth, when we talked about medication that helps you feel better, your doctor should know about. Medicines come in different forms, so we know from tablets to suppositories to sprays to sublingual to injections. So drops, needles, ointments, puffers. I'm sure we could talk about all our different ways of putting medication in. As a diabetic, I have a subcutaneous injection I take every week that stabilizes my A1C. I'm trying to get off medication, so working with my doctor and pharmacist to see what helps me and what is the best for me and my body. Thank you, Samantha. Here's my so these are some of the, what's that?
You can't read it.
It's too light? Yeah, it doesn't look, I see that. Yeah, this is very, I know what you mean. It's not enough contrast or something. So these are some of the very, some of the very familiar natural products that we take. Cranberry, we know, helps with alkaline in our body, can help with urinary tract infections and stuff like that. St. John's wort for depression. Glucosamine for joint pain and to keep I used to give glucosamine to my dog. Ginseng, milk thistle, these are all, Rick's father used to put garlic in his socks, I believe. And, like old wives' tales. My grandmother always took a tonic before bedtime. I used to make it for her. It was hot water, apple cider vinegar, a little bit of cayenne pepper, a little bit of maple syrup, and that's what she had every night before bed. Ginkgo, cranberry, ginger. Ginger's a big thing, yes?
I'm just curious, with the apple cider vinegar, did your grandmother have any teeth? It can wear the enamel off.
Yeah, I'm trying to think. Did she have her own teeth or did she have dentures?
You have to be really careful with that.
Yeah.
I haven't had problems with it, but my sister,
Really? It affected her.
Yeah.
So there you go. Even something like that, good to talk to your doctor about the impacts that it can have that you don't realize. So they're not regulated. So with my sister-in-law, who was encouraging me to take her bone builder, it's like my priest takes it and it's helped him. And she had her bone density tested and it's better. And I was like, Deb, I need some peer-reviewed research on this. Like, tell me if it's good, because then, I'll talk Rick into taking it. And so she sent me an article, but it was an opinion article. And I was like, you are a nurse. You know what peer review means. Like, I want to see research. I want to see what more doctors think about it. And she poo-pooed me. And I was like, I care about what I put in my body. I want to understand it, from vaccines to everything. I want to understand how these things interact to help keep me healthy. So it's important for your physicians, pharmacists, whatever, to know any of these other things that you're taking. And some of them you can buy at the store. So you can ask them right there, like, will this be helpful or will this not be helpful? What do you think? Thank you, Samantha. So side effects, we've talked about this. And when you get the list of possible side effects, it's like listening to U.S. news. When they tell you Prevagen is going to keep your memory going forever, but it also might kill you, when they list off all the side effects. So it can be a little overwhelming. So your pharmacist is definitely your ally in this. They have a policy, they have a code of ethics. They are not trying to sell a product. If you ask them to see because a lot of products will have off-name brands, they will try to find, for example, medications that are in pharmacare. If you are in pharmacare, medications that will be covered because they don't cover everything. So they will help you do that. When Mom came to Nova Scotia, her doctor sat down with her and went over medications that were covered by pharmacare in Quebec. She was moving from Montreal, that were not covered in Nova Scotia. So they went through, she was also diabetic, went through the medications she could get on pharmacare here that she, you know what I mean? So it's always good to have a good relationship with your pharmacist. Dizziness, rash, difficulty breathing, confusion, mind fog, those are all side effects that can happen. Dry mouth, dry eyes, joint pain. I mean, they have stuff listed there, but falls is a huge thing that can happen. And I'm sure you've heard of some friends or family members that have had new medication and, you know, getting up and have a fall. So especially around blood pressure medications and stuff like that. Blood sugar medications, low blood sugar or ketoacidosis is a very dangerous thing and can be a medical emergency. I know when my blood sugar drops, I am cranky like you would not believe. And tell me, JoAnne, take a candy. I'll say, I don't need a candy. Like my personality changes completely. I become, well, my husband says that, I become obstinate. So that's my side effect. So if someone or yourself are having a bad reaction, if there's any doubt, there's no doubt. Call 811 or call 911 and let them know. They can come do a wellness check and check on you. If they're not taking you to the hospital, it doesn't cost anything. If they're taking you to the hospital, you need to go to the hospital. And if paying for an ambulance trip is cost, it makes you think that I won't call 911 because I can't afford it. Call me because EHS has forms that you can fill out to get compensated for that, or that you don't have to pay for that. It's income tested. 811 is a great resource. You can call them and you will be triaged by a nurse on the line who will tell you, yes, this is emergency, no, this is not an emergency. They will check the medications that you're taking as well. They will ask you, what are you on? And then they will say, well, I remember once I had swelling in my mouth. I thought maybe I was having an anaphylactic reaction to lobster. I've eaten lobster all my life, but all of a sudden this part of my face was all swollen. So I talked to the nurse and she said, it could be the lobster. Tell me what medications you're on. So I read the medications, and the blood thinner I was on could cause, I learned a new term, could cause, it means swelling, edema. So I had edema in my face. And she said, because your mouth is involved, you need to go to emergency because it could be anaphylaxis. We're not sure. So my husband had the same thing a few days later. He didn't have to go because he wasn't on blood thinners. So they're really good at telling what you need to do. And when you call 811 and they determine it's emergency, they tell you where the closest ER is, and they will call ahead so that they know you're coming. So it's very helpful as well. We can move on. Okay, and we talked about, and you can find this online or talk to your pharmacist about it. Food can interact. I know on some of the medication I take, I can't take grapefruit. It's a no-no. Sometimes we're allergic to components of a medication. So not the medication itself, but there are elements. So we know with vaccinations, some of them are suspended in like an egg thing, which people are allergic to. I'm not sure if you had children, if they had immunizations when they were younger, but same thing, right? We know that some kids react to some of those, the MMR and those early life vaccines because of that. Milk is a really hard one for everyone. Dark green vegetables can combine with medications and like cancel the effects altogether. Herbal teas, and we looked at the ginkgo and ginger and all that. That's still a way of ingesting something to make you feel good. Thank you. Common mistakes. I forgot I took my pills this morning. Did I take them? Didn't I take them? So taking the wrong dose, not finishing medication. How many of us have a drawer with medication we didn't finish? It drives me crazy. My husband went on antibiotics and he started feeling better, stopped taking them, and I was like, where were you when we had our 3 kids? Like, you take the medication till you're done, not till you feel better. Like, obviously, you weren't part of that conversation. But using expired or discontinued medications, I mean, you take cough and cold for one winter and you don't use it for a couple of years, and oh, here I have a cough starting again. My medication is expired, but I'm still taking it. Sharing medications with others. You know, oh, we're going to the Dominican on a vacation. I'm flying with my mom. She's nervous about flying. I'm like, oh, I have some Ativan. Here you go. Never do that because we don't know how it's going to impact mom, right? That medication was not prescribed for her. Mixing medicine with alcohol, a big one. Always talk to your doctor. I think every bit of medication will say talk to your doctor. And not just alcohol, with taking marijuana or like THC or CBD as well. Lots of people are taking that. It's great for a lot of things, but you need to talk to your doctor, same as alcohol. Does this have a counter effect with this medication? Forgetting to make medication at the right time. Stopping and starting medications instead of continuing regularly. Again, when I started taking these pills, I was overwhelmed. I went, I'm sure for the first year that I took them, I was not in the habit of taking them. And so I would miss 5 days and then take them. I mean, what's the point then? So yeah, I got a talking to by my doctor. Thank you, Samantha. Common reasons for misuse. Again, it all comes down to the stories we tell ourselves about the medication. We're not always wrong either. We have life experience. We have friends with life experiences. We have extended family with life experiences. More is better. Is more Ativan better if you're really freaked out? Probably not a good thing. But I mean, if it's your medication, your doctor would have tell you if it's not covering your anxiety or your panic attack, take another one. But don't give it to anybody else. When you're taking a new medication, the pharmacist will often want to speak to you. Sometimes they're very busy. I would stop and wait if I'm getting a new medication to have that conversation with the pharmacist, or if I have any questions. And I asked to go into the office with them. So not that long ago, I was standing in the lineup to pick up medication, and there was a young man standing in line who had erectile dysfunction. I'm just telling you. So we're all standing in the lineup. Lots of people look like me. And this guy that's probably my son's age is standing there. And the pharmacist is just talking really loud. So how's the erectile dysfunction this day? And we're all standing there. And so I just said to her, could I talk to you in the office about my, I don't know, I said something, about my erectile dysfunction. I don't know, I said something silly, but my husband was like, you just should mind your own business. And I thought, oh, that's humiliating. He probably didn't have the sense to say, I don't want to talk about this out there, but you could see he was uncomfortable. So if you want to talk to them, ask to go into, they have an office. All pharmacists have an office you can talk to them in. So if you want to be private, you can be private. Complicated schedule, not understanding how long it takes, especially with SSRI, so serotonin reuptake inhibitors, which are often mood stabilizers for anxiety, depression. Many of us have been on them for a long time. Some of them will will be prescribed them as well as we age, because life is hard and we may need them for anxiety. And sometimes it takes 6 weeks for those medications to really get into our system and that we start feeling effects. But with every medication, it sometimes takes a long time. And if you're someone that takes a long time to metabolize stuff, it's going to take longer. And don't like the side effects. If you don't like the side effects, talk to your pharmacist right away, call your doctor or go to a clinic. But your pharmacists are able to do so much more these days. We found out of COVID and the lack of family doctors in Nova Scotia. Pharmacists are prescribing and doing some, like with UTIs and stuff like that. Yep.
Sometimes the side effects, you go in and they say, well, just because you don't like the side effects doesn't mean, but sometimes those side effects can be dangerous.
Yes.
So, they don't always listen to you.
No, that's right.
I had an allergy to a drug, and I was on it for 7 or 8 years, and it was a severe allergy. Nobody could figure out what was wrong with me.
Oh dear.
And I think I had every test going in the hospital.
Yeah.
And it wasn't until COVID hit, and my doctor took me off of that drug to try 5 different kinds. The effects disappeared.
Isn't that something?
Yeah.
You know how you feel the best.
Yeah.
So,
Well,
and you need to advocate for yourself, right? You have to say, something's not right here. Something's not feeling correct here. I'm not feeling myself. Even things like dry mouth. There are things that are easily taken to help with that. A lot of medications cause dry mouth, dry eyes, dry skin. There are medications out there that can help with that. Even a simple mouthwash can help with that. I know my sister gets dry mouth all the time. And so she even has to add stuff to liquids that she drinks because she chokes on them. So she adds a thickener to anything that she drinks because her mouth gets so dry and she can't swallow liquid, she chokes. Thank you. Medications. Well, we don't take them. Other things. The lids are hard to open. I have so much trouble with childproof lids. I just can't open them. And my husband laughs at me and says, "Ugh." And I said, I don't know. My thumbs really bother me. Like my mother had osteoarthritis. My sister laughs at me because I say, I think I have it in my thumbs from all the typing and stuff I do, and I can't open stuff. And she laughs at me because, her fingers are arthritic. Mine are not. But anyways, I'm like, oh, my thumbs ache, man. And I can't open those jars. So I can't open anything. I actually think my husband is trying to gaslight me and makes everything super tight. So I think my arthritis is worse in my fingers and wrists. Instruction, oh my God, I have a magnifying glass at home, like this little turtle to read anything because the writing is so small. You can ask the pharmacist to make that bigger for you and put it on a sheet, right, so that you can read it. The pills, oh my God, I hate swallowing pills. So, there might be a different way of taking in that medication. I hated swallowing my pregnancy iron pills. I would gag every time and just hated the side effects and everything. And the doctor said, you're going to be a mom. You're going to hate a lot of things you're going to have to do. So this is for the baby. It's not for you. Medicine is expensive. So, if it's not covered by pharmacare and you can't afford it, some medications are $7,000 a month. I've known people taking medications that are very expensive, especially some of the cancer medications folks are taking at home and stuff like that. Not under pharmacare yet, but they're life-sustaining medications. And confusion. If we develop any kind of brain fog, if we're stressed or burned out, that can cause us to forget stuff, We do a Understanding Dementia Behaviors workshop, and we know we have a lot of dementia in Nova Scotia because we have a high senior population in Nova Scotia. I think probably 60% of my caregivers are dementia caregivers. They're caring for someone with cognitive decline. And probably over 70% of my caregivers are seniors as well. So they also have their own health stuff going on, and they're caring for somebody else as well. So I really worry that caregivers are taking care of themselves, because we often put our care at the back because their life becomes the life that we're focused around, and we're in their orbit, taking care of them, making sure they're fed, taking their meds, that they're clean. And so we put ourselves to the back. A pharmacist is so accessible right there. You're maybe even going to pick up meds for someone else. Bring your stuff and ask them questions if you have any questions. They are happy to answer. There you go. Thank you, Samantha. We know that you probably have some of these. I'm diabetic, so this is something that lives in my house. When it's full or when I get tired of the size, I bring it to the pharmacy. They give me a new one. No cost. These things you can buy. I think this is I have one that's Monday to Thursday, but I have more pills than fit in there well now. So these things are great. I know they help me, and especially the morning and afternoon ones, because like right now I put my afternoon pill on the side of the windowsill. That's where I look to remember to take, but we all do stuff like that. Anyways, I could do better. There are also blister packs for those of us that can use that, and I think that's what I'm going to go to. It's just easier for me because I can look and say, oh, I didn't take those. And follow them that way. Some places there's a cost, some places there is not. But again, talk to your pharmacist about that. Thank you. Yep, and there are wonderful timing machines now that you can get through Northwood that dispense the medication. If you live alone and you forget, you can get these things that will dispense the medication at your mealtime or the same time every day. Here's your morning pill, here's your afternoon pill, here's your evening pill. And that helps as well. Okay, thank you. I didn't know this. So proper storage of medication also impacts your medication's efficiency. So storing it in the bathroom and kitchen, they say, not a good idea. I keep mine in the kitchen. My husband keeps his in the bathroom, right? Because in the morning, get up, brush your teeth, take your morning medications. Depending on your washroom, it could be really damp. So if you don't have the proper ventilation, it can cause, molds and mildew and humidity that might impact the pills. In the kitchen, same thing. There's a lot of heat in the kitchen and stuff like that. They say a cool, dry place. So pantry, I think would be fine. Or some medications have to be in the fridge, and keep them in the fridge because they do lose their potency. Minimize the number of times bottles are open. So prepare your medications once a week if you're using one of those things. Or, handle them once a day or once a week or whatever works well for you. Keep them all together. Well, my husband and I keep ours separate because he travels for work and I don't, so we do that. And of course, keep meds away from children and pets. And I have to say, I'm bad for this now because I have a friend staying with me who has a dog. I'll drop my medication on the floor and then I'm like, oh, there's all that, I dropped 20 metformin pills. I don't know how many I dropped, but I have to find them because I have a dog in the house that might, so we worry about those sorts of things. Thank you. Return unused medications to the pharmacy. Don't flush them or throw them in the trash or anything like that. No matter how old they are, no matter what they are. Bring them back to the pharmacy. We know, right now on the news this morning, they're talking about salt in fresh water, like the salt from the street going into our lakes. Medication goes in our wastewater too when you throw it down the drain, right? And so I don't think I want to swim through someone's, Viagra. No, that's a very bad image, but you know what I mean, right? It impacts our environment for sure. And don't give unused medications to other people. My mother died. She was taking, she had tons of metformin. She was like, take that stuff because I'm not going to use it anymore. I'm on my way out. And so I had her metformin, but I knew it was 500 milligrams a pill, and it's exactly the same eye pill. So I did take it, but I probably shouldn't. But, we all try to do things to cut costs and expenses and stuff like that. But that's probably something I shouldn't have done. Yes?
I live on allergy pills, and my children have allergies. So if I don't use the whole prescription, they use the rest of it. It's the prescription one.
Yes.
But it's the same as the over-the-counter one. It's
Yeah, and that's a good thing too. If you can get something prescribed instead of it coming over the counter, sometimes you can get it for less expensive as well. So you can have vitamins prescribed and Tylenol prescribed. My husband takes, what's the other one? Advil for inflammation, right? He's got bad hips, so he takes Advil every day, and then something for his stomach. And so, the pharmacist can help you with all that kind of stuff. Does he listen to me, my husband? No. I teach this course, and anyways. No. All right, because he thinks he's 30. We'll just keep going. Thank you. So your pharmacist is the best person to talk to. They're in your community. Lots of us have relationships with our pharmacists. If you don't, bring a cup of Tim's. Like a PC edit. Right? We're buying an election. We're buying votes now. Things are getting crazy. Anyway, so your pharmacist is a great person to help you keep track of what medications you're taking. They say only use one pharmacy. If you can do that, that's great. Sometimes we don't have that luxury, but lots of people will go to the pharmacy near their healthcare practitioner. Some will go in their neighborhood. I like mine in my neighborhood. I live out in St. Margaret's Bay. I know my pharmacist. We talk whenever I go pick up something. They know that I don't have erectile dysfunction. Just kidding. Okay, thank you. We can go on. So this is the program that your pharmacists all adhere to across Canada to do medication reviews with you. And you are entitled to those. They are free. Some places are charging for some things now, but that would be an individual pharmacy kind of thing. But your pharmacist is there to help. And in your pamphlets, you have a list from the Nova Scotia Department of Health of what pharmacists can diagnose and what kinds of prescriptions that they can, because they can renew a prescription for 3 months if you can't get in to see your doctor and stuff like that. And your doctor can call them and just send a new order for the prescription as well, so you don't have to do a doctor's visit all the time.
So, anything across the board that you've had, like I've been on the same medication for years. The last time I went in, they would not renew it.
Okay.
Maybe it's a Costco policy.
Mm-hmm. They will do it like for 3 months, and then you have to get a review. But it depends on the medication too. So I know I have a child on ADHD medication, can't get it at a walk-in clinic because it is a controlled substance. It's Ritalin, right, which is a upper, I guess, and a lot of people use it to make other drugs. And so that is controlled, and they won't give that out at a walk-in clinic. They won't give out SSRI, so our mental health medications and stuff, they don't give out at walk-in pharmacies. But your pharmacist, if they know you have been on it, might be able to do that. But that would be a conversation you have with them, for sure. Thank you, Samantha. always write down your questions. Bring somebody with you when you go see the doctor. I know I verbally process things. I don't. I have auditory processing disorder. So when there's noise in the room or when I'm anxious, I can take in information, but I can't process it. So it's just jumbled. And lots of people have this, I guess. So if there's a fan going or anything happening, I can't hear very well. So I do need somebody with me. I'm like that TTY person on the phone. COVID was hell because I'm a lip reader. I didn't realize that until COVID. Like, people would talk to me and I'd, do the nod. Yep, okay. No idea what people were saying to me. So write down your questions because we forget. We have cell phones now. You can just put them in there as they come up. Ask questions, make notes to make sure you understand. Ask, call back and say you were unclear about something. Ask for referrals if you need a referral, even to things like physiotherapists, dietitians. You get a diagnosis of type 2 diabetes when you're in your 60s. That's a life-changing diagnosis and you need help, right? You can't eat in the same pattern you were eating before you were diagnosed. So go to it. We have dietitians in community. We have a diabetic clinic. Sometimes we don't know these things. So use your support team, and the pharmacist is part of your support team for that. And bring a list of your medications. I have some stuff here. Some of you may be familiar with the Vial of Life. Okay, so this is something that the BON has discontinued, but we have lots left. And it's just a really handy thing. It's a list and you put all your medication that everyone's taking in the house. Sticker goes on the front door, so EMTs that are coming in the house know that this jar will be, or this will be in your fridge with all the medications listed on it. And so I have people that put pet stuff in here, all kinds of things. So these are here for you if you would like to take some with you when we go. Yep.
Okay, that's what I was going to ask.
Yeah, so.
But the list of medications, you can get that from your pharmacy.
Yeah.
But just make sure, and I experienced this with a friend of mine, she got blister packs. Mm-hmm. But because they were trying her on other medications, they were not in the blister pack. Mm-hmm. So and it's very important because some of them can interact with things, especially if a paramedic is standing there saying, what do you take?
Yes. Sorry, I'm having a stroke. I can't tell you right now, right? Yeah. It's that way. We don't know. I know at work we had someone was having stroke symptoms. You want to talk about, and we got stuck in this. Do we call 911? Don't we call 911? Like, what do we do? Well, if there's any doubt, there's no doubt. That's what I've learned. If there's any doubt, call. And so she was having a stroke. We had no idea. She was like, I feel okay, but we could see some drooping in her mouth and her arm was different, and we did the whole laugh. The rice. No, that's for when you injure yourself. Face, thank you. the ad on TV. Is something going on here? Your tongue, can you smile? Tongue rolls. Some people can roll their tongue, some people can't to begin with. So if you were never a tongue roller, like this thing, if you've had a stroke, you can't do it. But some people can't do it anyways. It's a genetic thing, so that's not a good one. But bring your list of medications and the medicines that you take. And you can get it from your pharmacist, but if you've been given a medication at the hospital, like you said, it may not be on that list. So keep your list up to date on your phone. A lot of us have a safety thing on our phone where you can list all your medications as well on your smartphones. This is what's in the Vial of Life. So health history if you want, medications, allergies, and people in the house. So if you have more than one person living in the house that's taking medications, you can put 2 sheets in there. Everything's there. Thank you. Oh, I'm sorry, that's my phone. That's my husband. Okay, so all of you have a Safe Medicine for Seniors guide in your handout there. That guide is very helpful in so many ways. Okay, common problem. Sorry about 20. Okay, we can go ahead. I have tons of them. So if you want one, I'm going to, and in there you also have an evaluation sheet. If you want me to send you some, just let me know on that sheet. And I will send it. And I know we have people joining us. Joining us virtually. If you would like one, contact me at Caregivers Nova Scotia. My email address is halifax@caregiversnovascotia.org. My name is JoAnne Connors, and I can send them out to you. Our pharmacists can also, well, I'm still back on what the pharmacists can do, but they do our flu shots, our COVID shots. There's so many things they can do, and as I said, the list is in your, let's see, healthcare services available from pharmacists. So not all pharmacies will offer all these services, but most of them do. All right, so in the book, you're going to have all these, a lot of what we went through. And they have all these wonderful things where you can list your medications, you can put the questions that you have, you can keep track of how you feel when you're taking a new medication, tips on what you can do if you're feeling side effects, any problems that you're having, medications. We talked about some people have trouble with pills and stuff like that. You can log all this stuff. And so it's an instant book. Similar, oh gosh, I'm so sorry.
That's okay.
I'll just turn them off. I do love my husband dearly. We've been married for 40 years, so he can wait. All right, so it shows you how to respond to some common problems with medications that we're taking. So if you notice anything, not an emergency, but you notice something, write it in there. And you'll see tips on what you can do. Any problems with your mind or body. So that's side effects again. Are you feeling like you're having trouble organizing your thoughts or sequencing things or getting it together? And one medication that I took for a while, I wasn't able to figure out a calendar. Weird, right? I'm looking at my agenda. I use a calendar for work all the time, and I was looking at it saying, what? Anyways, medication I was taking was giving me brain fog and was causing me having trouble sequencing. So it can compound stuff that you already have. I have the auditory processing disorder, which can cause sequencing issues for me. I can't tell a joke, for example. I have to keep going back and forth. My husband says, there's the story or the joke, and JoAnne has to go off a limb there and off a limb there and off a limb there to come back to the story. And sometimes I never get back to the story. So
It can also mess with your sleeping patterns.
absolutely, which is huge, right? So you can keep track of all that stuff in here as well. And everything that we went through, including side effects and all that, is all in here for you. So it's an excellent tool. Answer the questions. I mean, just to keep a diary. Start off. I can send you a new one if you want a new one in a year or something like that. I looked online to see if we could download it or order it. You have to get it from me. So I'm happy to send them out. Go through the sections, answer the questions. I don't have extra ones, but if you have somebody in your home or a friend or a neighbor that might want to go through this as well, just let them know and I will send them stuff. All right, thank you, Samantha. And these are the sections in the book. So exactly what we spoke about. And if you're a caregiver, you can also use the book for observing changes in the person that you're caring for. They may not notice that they get grumpy when their blood sugar's low, but you will notice. I don't notice when I'm getting cranky, but my husband notices, right?
He does.
Oh, yeah. I notice when he gets cranky too. But another thing will happen to me, and I can't see it. I'll get little dots of sweat on my nose when my blood sugar is dropping, when it gets to like a 3.
Scary.
Yeah, right? And he's like, JoAnne, your blood, like, oh, I know why you're cranky. Have a banana or something. But sometimes we don't notice what's going on with ourselves. So it doesn't mean that I'm cognitively impaired or anything like that. I just don't have that awareness at that time where my blood sugar is dropping and I need support. He says, am I your caregiver then? I said, no, you're my lifeguard. There's a difference. Thank you. We're good, Samantha? Oh, there you go. So this is also a book you can bring into your pharmacist and talk to them about it and ask them to help you fill it out. And certainly different times for a medication review, every couple of months if there's been a change in medications, if you've dropped one or you've needed a new one, or if you've been to the hospital or have a new diagnosis. All good times to have a medication review. If you're off a medication, it's a good time to get a medication review as well. Thank you. And take the time in the next couple weeks to have a look at the manual and see what you think. And if you have any questions, my card is in there. Give me a call. If you're a caregiver, I would love to hear from you and talk about this further if you have any questions. And yeah, I suggest you talk to your number one ally, your number one. We all have care teams, right? We look at our physician as our primary, call them primary care practitioners, but there are other people in your circle of care as well. And I know I keep pushing the pharmacist, Mr. Pharmacist. We weren't able to get someone to come today to answer specific medication questions, but I know you can go to your pharmacist and ask them.